All right, everybody. Today I'm so excited to have Alison Hall, the one and only, here on our podcast. Alison, thanks so much for joining us.
Thank you for having me.
Absolutely. Allison's got the baby there, a new 11-week-old baby, so thanks for bringing the baby on as well. Allison, happy to talk to you today. Allison is the co-owner of Enlighten Nutrition, Counseling and Care. She has locations both in Leesburg, Virginia and Silver Spring. Allison's a registered dietitian nutritionist, certified intuitive eating counselor, and a certified personal trainer. She's deeply committed to helping her clients foster positive relationships with food and themselves. Drawing from her experiences as a college athlete, Allison is particularly passionate about working with college athletes and individuals navigating eating disorders and disordered eating. She and her team at Enlighten also provide accessible and holistic care for a variety of conditions, from women's health to GI and chronic conditions. So excited to get ready to dive in and talk about more nutrition, self-care, and the meaningful impact you're making on the community. So I didn't even know there was a difference between eating disorders and disordered eating, Allison. So I'm excited to talk to you about that. Also, I'm excited to talk about your work with college athletes. So we'll get into that a little bit later. But first, let everybody know just a little bit, about yourself. Did you grow up in the area? What's your background? Obviously, you're a college athlete. If you can touch on that a little bit and kind of how it fostered you owning and starting Enlighten Nutrition.
Yeah. So literally my senior gift, they give us all jerseys when we graduate.
Nice.
Hanging up in the background.
Atta girl.
But no, originally from North Carolina. My husband and I are both from small town Boone that actually just got hit by the hurricane, Helene, back in the fall. We have been dealing with that aspect. Both of our parents were okay. So he got a job that moved us up here to Northern Virginia. Don't think we would have ended up here had he not. I kind of assumed we would have always stayed in North Carolina since both of our parents are there. And we're small town people. So now we live out around in Percival. But at some point, he wants to move out even further, like Buckets or somewhere to have land in the middle of nowhere with no neighbors.
Yes, him and me the same. Jasmine will not let me do that, but that's my goal as well. I don't want to be able to see my neighbors.
Yep, that's his goal too. So originally started in Boone. I went to undergrad and grad at Appalachian State University before coming up here. The plus about becoming a dietitian is you have to do a year-long internship. So I was able to kind of do like a hybrid new program where I did my master's on campus, like you always do. In the second year, you always get assigned a location. The cool part is I got to kind of pick my sites instead of doing their traditional where they assign us, which allowed me to come up to this area and kind of start making connections a little bit earlier. And then graduating, becoming a new grad, moving up here, and then starting from scratch. Kind of went to app originally just because, sports kind of drove me to the schools I went to. I actually started off at a small D2 school in Charlotte before I transferred to Appalachian as a junior. I did sports at both, so I had that experience of D1 athletics and D2 athletics. And there are, there's practice feels about the same. All of those things feel about the same.
Yeah.
But the cool part about, becoming a dietitian from that then, because I actually started off as a chemistry major, was seeing the differences of nutrition and the importance at the D1 level versus the D2. Most D2 programs, no dietitians, not a whole lot of education on what athletes need to eat and how to fuel themselves. D1 level, we had one main dietitian, we had fuel stations, we had kind of some other things, and the bigger schools you go to in the Division I, the more likely you are to see more of a nutrition program, which emphasizes, the importance of, collegiate athletics and the nutrition aspect. So that kind of got me here in dietetics. I started off with chemistry. Didn't really know what I was going to do with a chemistry degree. My mom was kind of like, okay, well, hey, like, you need all this chemistry and then you need this for nutrition. What about nutrition? And that's kind of how I fell into that realm of dietetics in particular, but always knew I wanted to go to healthcare. So it kind of like just blended the two of them together, which worked out really well.
Awesome. Okay. Great. And so you moved up here with the husband, because of his job. Tell me about like those early connections, was how that was important for you, or what did you do specifically to make those connections in the Northern Virginia area?
Yeah. That was probably the hardest part is you cold call people or cold call email them, hey, I want to be an intern. Would you consider taking me? They don't know who I am. They don't know my program. Not a lot of people know Appalachian. A bit more do now that, we're in that JMU is in the same conference as App now for a little bit more recognition. But it was really exciting because I was able to kind of get my name in there. I'm still Facebook buddies with two of my preceptors and the people who are over me when I was at my job site in clinical. Two of them were still Facebook friends. We chat every now and then. One of them, we hang out with our kids now. So just kind of give me that level up of, okay, I got to kind of know the area, figure out, where you might want to live, where I might want to take a job versus, if I had just moved up here, I would have been, maybe this is close to my apartment in Sterling. I don't know how close this is. I kind of got that insider tip and knowledge, which really I think helps me now because, now I'm pretty involved within, we have a governing board of dietetics nationally, and then there's state chapters, and then there's districts within. So now I'm within the district, so the Northern Virginia Academy of Dietetics, pretty connected there. And I would say, getting involved and getting to know people right out still grad school really helps me now just feel more connected within dietetics and not just the eating disorder dietetics world, because that's a whole other bubble over here.
Got it. Okay. And how about as playing, since you were a college athlete, how did that influence, your decision or your passion for getting into dietetics, eating disorders, and everything else?
Yeah, I think a lot. I started off as a gymnast. So for 10 years, I did competitive gymnastics before I switched to track and field. And in particular, I did pole vault, which is one of the sports that, your body weight does matter. Come on. Don't so good. Okay, we'll sit up. Hey, don't be drama queen. All right, we'll sit up.
That's okay. Totally. I'm excited to have her on because she's the first baby on our podcast. So might as
I'm so
well
dramatic. She says, you want to say hi?
say hi.
Do you remember him? You spit up on him.
Yeah, that's okay. Hey, she spit up on me and now she's on my podcast. If you need a babysitter, just give me a call.
I'll just drop her by.
There you go. There you go.
So really for me, I came from two body focused sports.
Yeah.
So that kind of let me know the emphasis, and really now in my professional career helps me identify with, I do tend to see more of the body focused athletes in particular, because I have that experience of, some coaches are really good. Some coaches understand, some coaches, don't put any of those judgments or placements on you, and some do. And it's just, the world is changing, but we're just not there yet. And that's okay. So I think that kind of drove me to this field of, okay, well, how can we better educate coaches, better educate parents, better educate athletes on just the importance of nutrition, and then, nutrition plus the eating disorders and the awareness of disordered eating
Mm-hmm.
as well. Because a lot of statistics show that, a huge population of athletes will report disordered eating. So they're not diagnosed with an eating disorder in terms of meeting, criteria, but they have those behaviors that are troublesome and are not normalized eating behaviors.
Okay. And you said body focus athletes. What does that mean?
Yeah, so we're looking at the body focus in terms of, gymnastics. It's a body focused where you're looking at aesthetics, so body aesthetics. So swimming's another one, rowing's another one. So it's kind of where your body weight carries to an extent of in terms of your looks matter.
Okay.
Yeah, so swimming, diving, gymnastics, rowing, those are kind of some of those big ones. Wrestling for boys.
Right.
We flip over to men's, that's one of the ones for them too. Yeah.
Okay. So any sport that your weight is a factor in the sport or
Yeah.
got it. Okay.
Body aesthetic.
Body aesthetic. Got it.
Is.
Okay. And what is the difference between eating disorders and disordered eating?
Yeah. So we have the DSM-5, it's the diagnostic manual to, I think you guys have that too, to diagnose eating disorders. So you have to meet the criteria within those. And so that will be your anorexia, bulimia, binge eating, other specified eating disorder. And there's certain criteria for how much food you need to be restricting, what labs may need to be, what body weight should be, how often you're engaging in behaviors. So what we see is, those people are eating disorders. You check the boxes, you fit in one of those 5 categories. Now, when you flip it over to disordered eating, it's somebody who doesn't necessarily have all of the signs and symptoms to fit into one in particular. So it's somebody who maybe counts calories, but they're not necessarily restricting their food to 50%, 70%. They don't have huge body image concerns. So it's kind of someone who's, dabbling, and it's still very much troublesome in terms of they need care, just like eating disorder patients do, but they're not full-blown textbook diagnosed eating disorder yet. And I say yet because very often, it's kind of that slippery slope of I'm going to count calories or I'm going to do this. And next thing you know, we've picked up other behaviors and, we actually are now a DSM-5 diagnosis of an eating disorder.
Okay. So the eating disorder is you have to fit within the DSM-5, where disordered eating, they might just have bad habits around eating or something like of that nature. Okay. And tell us how it was opening your first location was Leesburg, correct?
Yep,
All
Leesburg
right.
first. Oh,
Tell
baby.
us, tell our viewers a little bit about opening your first, small business and how that went.
Yeah, that was a time. We opened up in 2021, right in November. So really, we just kind of opened the door. We really didn't hit the ground until January, obviously, of 2022. And the funniest part is we are in Leesburg. But since you brought that up, we had actually originally planned to be virtual to start off
Okay.
our practice.
Uh-huh.
Because it's really popular nowadays, especially since post-COVID. A lot of people are opening up virtual practices. Telehealth is so convenient nowadays. And if we're being honest, you minimize a lot of your costs because you don't have to have rent
Yeah.
and that additional insurance for having an in-person office. So we opened the doors in January for clients, and by February, we had found a space to rent per hour because everybody who was calling wanted face-to-face because so few people were back for face-to-face services at that point.
Wow. Okay.
Especially when you look at the demographics, Leesburg pulls from Western Loudoun a good bit, and even down to Winchester sometimes. So there's a lot of eating disorder practices, east, and kind of Leesburg over is kind of a dead zone other than us and Allison Temper are kind of the two practices in this area. So because of that, we went face to face really early, set up our base in Leesburg, and pull from, Western Loudoun, West Virginia, those areas, which really helps. And that kind of got us to open the door face to face quicker than we intended. The original goal for the practice was, hey, my co-owner and I both started at a higher level of care because there's different levels of severity your eating disorder can be and what care you need. So we both started at a higher level of care together, and we were like, hey, let's open a business together at some point. So we both went separate ways after we left that first job, came back to each other, like summer 2021. We're like, let's do it.
Yeah.
Met in Barnes and Noble in a coffee shop, planning it out. Here we are, almost 3 years later.
Awesome. And why? An interesting question because I've done therapy in person. I've also done it virtually. What do you see with your clients, since you've done both virtual and face to face? Now, I'm sure COVID is a big factor in there too, right? Like, do you think a lot of people, regardless of COVID, do you think a lot of people thrive for the face to face? Or, now that after COVID, do you think people were just wanting the face to face because everybody was virtual for so long?
I think it goes both. I'm still surprised by the amount of virtual people we do have. I think for adults in particular, it really became convenient. You could do it on your lunch break. You can do it right when you get home. You don't have to drive to the office, which would take an extra 15 minutes total, maybe 30 minutes total if you drive each way. What we see with teens really struggled with virtual in general during COVID. I think if we were to just go ahead and be honest,
Yeah.
that's just not a great, they didn't do well with school. School is hard virtual
Yeah.
for so, of course, therapy is hard for kids virtual. What we find with some adults, though, especially on the therapy aspect, is some of them are just more comfortable being in their own space. So that's one of the advantages to the virtual care is they don't have to leave their home if they're in body, and that's something they're working with is, anxiety, getting out of the house in general. That accessibility to telehealth means, their care's there and they don't have to figure out how to get the care and, challenge themselves every day to get out of their house. So that's the plus there. I think some of it's avoidance, though, too,
Hmm.
on the flip side for some people. But I do think at the end of the day, your face to face care is going to be a little bit better. Hey,
Do you think the face to face is better for your client or for your patient because they get better results face to face versus virtual or
I think it's a little bit easier to truly get to know each other face to face. There's a level of deception that you can play virtually, in terms of
sure.
how transparent am I being, because
Yeah.
you can only see, from here up.
Yeah.
So maybe they're shaking their legs, so you can't tell that they're super nervous the entire time, or they're tapping something, or you kind of miss those, nonverbal cues that I think are really important to pick up on in that face to face care.
Okay. And so I know that you kind of focus some of your work extensively with athletes. Tell us a little bit about that. What type of athletes do you like to see and how that approach, has helped them overcome, their challenges?
Yeah, I really like seeing any type of athlete. In particular, I'm picking up the athletes who do have disordered eating or eating disorders. So I don't do just basic sports nutrition in terms of I'm only going to see somebody who has eating disordered eating behaviors and sports.
Huh.
So I don't do just the sports aspect of make sure eating enough. I could do it, but my kind of niche is the two of them together because it is kind of a dead area. There's different care. When you treat eating disorders, generally you pull activity from a lot of clients pretty early because often They to address behaviors and excessive movement or movement that is being earned is a pretty common behavior with eating disorders. So we want to limit those behaviors. So a lot of times movement is we ask them to stop for a month, 2 months while we work through other behaviors and then reintroduce it. If you have a collegiate athlete or even a high school athlete who's pretty serious, we're not going to tell them, hey, we're not going to do sports for 2 months.
Yeah.
So you really have to look at them from a different perspective and treat them, which is why it's kind of that specialty, because it does require different considerations and skill set.
Mhm.
And within that, most of my experience has been, I've seen a lot of cross-country runners in particular, that track and field, that aspect. That's kind of like my special population just because I myself came from track, but really I'll see any sport. I've had a few field hockey people. A good amount of males have come through the door, also cross-country as well. So track does seem to be pulled in a lot, but I don't know if that's just because I did track, so people see that, and it's how can I relate to my clinician best?
Right.
And that's fair,
Sure.
The special thing about eating disorder treatment is you're a counselor as well as a dietitian. So that rapport, you really get to know each other. You really want someone you're going to match with well. Advice and similarities, I think, really helps. And that's probably why I see more of my own sport.
Makes sense. Yeah. And with those challenges, because I have the same thing here. I mean, we're telling our patients the same thing, hey, you got to take a break for a month or two. But as you know, like as you said, serious athletes are not going to take a break for a month or two. So how do you navigate those types of challenges with your athletes when they can't, take off a month or two, especially if it's, mid-season or, obviously if it's off season, that's one thing. But how do you navigate kind of those challenges?
Yeah. A lot of it is, what can we negotiate? We don't want to negotiate care because, of course, your health needs to come first. Outside of, okay, you are stable enough to continue to move, but I need you to do this. The basis is that honest, kind of frank conversation of, I know you're in the middle of the season. I know we have games. I know we have practices. I know you need to go to them. Your behaviors concern me. This is why. This is what I need you to do in order to continue to participate in your sport. So it's kind of giving it back the accountability to them.
Mm-hmm.
I've had a lot of clients on what we like to call kind of treatment contract. And what that is, you're going to go to sport for an hour, but you're going to make sure you have a snack, 3 meals a day, 2 snacks, blank, whatever, kind of criteria of you're going to meet these goals in order to stay in your sport. And that can kind of help them with that extra accountability. And on the aspect of, us as professionals, yeah, it'd be best if you took a month off, but you can't realistically take a month off. Okay, we need to at least do this then, if we can't take that month off for your care.
And what with your high school athletes specifically, or college athletes, how do you discuss it with parents, when they are, like, say they're a minor? I know that's a big factor as well, right? Do you see a lot of like the frustrated jock syndrome happening, or parents that you sometimes have to set boundaries with?
Yeah, parents are the best and the worst.
Right.
A lot of clinicians will tell you if they prefer teens or they prefer adults. And a lot of people who do not like teens do not like the fact that you have to counsel the parents plus the kid.
Yeah.
So it's not just, hey, I counseled Keith. It's, hey, I counseled Keith plus mini Keith.
Yeah.
It's different. And the reality too with parents is it's a lot of education for them because you're right, half the time parents push sports pretty hard too. I think we know that. And, some parents care, some parents don't care. And that's, both aspects are great and totally okay. And it's educating the parents too to maybe why you have the concerns you have is the biggest key, is having that frank conversation with them. I've had some parents who are still sending their kids to sports in cases where the kid is way too sick. And hey, I recommend that your kid do be pulled from sport. And this is why. This is what I'm very concerned about. This is my concerns. This is why this matters, and educating them. Of course, sometimes they're not going to listen. And that's okay. And then it's playing the advocate too, because sometimes, kid is okay, and sometimes parents aren't okay, and vice versa.
Yeah.
And sometimes having them all in a room together to have a conversation can be really helpful.
Sure.
Because sometimes with a teen, you end up with the back and forth of they said this, and then, hey, can we talk to mom? Nope. Vice versa, back and forth. Hey, let's just all do it together.
Right. It removes any ambiguity, and then there's a lot of clarity when you have them all together, correct?
Yep, absolutely.
She's like, this podcast is too long, Mom. Yeah. What are some of the common misconceptions you see from parents about their kids, or maybe just from the everyday person about, college athlete, eating disorders
Mhm.
or any type of athlete?
Yeah. I think a lot of that kind of depends on what's normalized within your own household or within your sport. We kind of come from this world where it is rather diet culture still, in terms of grabbing the low fat items. Totally okay. If you prefer low fat, good for you. We love that. We love that for you. If you prefer the high fat, we love that for you too. There's benefits to both aspects. So how normalized are behaviors within the house? How normal is it for your mom to be, really stressed about making sure she gets her workout in? Or your dad, or how, what's that rigidity that you see in your own household for movement or food or blank, so on and so forth. Same thing within team culture. I think both of those really drive that more than anything else when it comes down to it, to be honest.
Yeah.
Hey.
Okay. Tell me about some of, the success stories you've had, or what do you types of transformative outcomes do you see with your clients when they, you get them to sign the contract, mom's on board, parents are on board, the athletes on board. What kind types of things do you see with the great results that you get?
I think one of the biggest one is I have this cross country runner who's now at Georgia Tech. Interesting enough, she was actually looking at they're blue. Pitt. She was looking at Pitt originally. And the funniest part is Appalachian State ended up hiring Pitt's coach the week after she committed to Georgia Tech.
Hmm.
And she almost went to Pitt instead. And nothing's worse. Every athlete knows nothing's worse than committing to a team and having that head coach leave.
Yeah, 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 yeah.
Right after you committed. And she was a client who started off at one of the higher levels of care, stepped down, kind of had a break in care, and then came to me. And, she's very type A. It's very common, especially with anorexia in college athletes, for they're extremely type A. And it's kind of that perfect storm.
Hmm.
They're really great students, they're really great athletes. They can be really good at their eating disorder too. It kind of cultivates for those people. And she was a case where super type A, really wanted to just do everything perfect, which meant she wanted to do her eating disorder perfect. Then she wanted to do her recovery perfect. But the reality is part of recovery is being flexible and having things change. And she was one of those cases where, she was being recruited. She was a serious cross country high school athlete who was destined to be recruited to a D1 school. And her parents were really serious. Her parents were very serious in the basis of, if you cannot prioritize your eating disorder, you will not run. That's how serious they were. They really prioritized her health, so much that she had a little oopsies at one point in the fall. Parents did not send her to national championships for high school. That's how serious parents are. And the great part is, in reality, as a provider, that's that's a perfect case to have the parents support you no matter what.
Yeah.
Because we do need more parents like that sometimes. There is the risk that they go out and it's cardio sport, and if they have severe malnutrition, their heart can give out on them. They can pass out because they're dehydrated. So there are those really serious implications. Our parents were very serious about her recovery.
Mhm.
We did the do. We met every single week. We worked through the steps. We, gave her her own accountability, because she got very comfortable with parents doing it for her. So a lot of it was, you do really well when parents help you. You want to run in college in the fall, and you need to be able to do this by yourself. So we were able to take pretty much from when she missed national cross countries as a big motivator all the way until like March. So that was about 5 months
Mhm.
to give her accountability to let her show parents that she could do it. And she did. And she is running at Georgia Tech now as a D1 athlete. Fall was a little bumpy. You have to adjust. You have to figure out what it's like. Her coaches know they're the registered dietitians for the team know, and she has that support. And that was a really good program for her to go to. So she is definitely one of those cases where it's like, you did the do, and that is amazing, and we are proud of you.
Awesome. So, a word to the parents, support the kids and make health their priority. When parents make the sport the priority or their performance the priority, do you think that's due to the stress or if they are on a scholarship, the financial stress of that or losing the scholarship, or is it more just something in the parents' head that they have their own issues they have to deal with and they're just projecting it on the kid?
I think a lot of times it's the latter. And I know, that's making an assumption, and there's definitely cases where that's not the assumption. And I think some of it comes from the drive of wanting your kid to do the best they can. And also the basis, of that tough parenting is, you signed up for this. Let's say it is the middle of the season. You're right. You signed up for this. You need
Yeah.
to finish the season all the way through. I see that aspect. And then the question is, when as a parent do you step back and say, hey, it's okay. We're not going to do this. When do you start to realize, okay, this is actually really serious for your health versus you're really good at winning and we really like when you win and we really want you to be successful. Okay, I want you to be successful and healthy. That's that kind of caveat, is when is that piece and healthy not being considered for parents, and when can they step back and see that?
So like you said earlier, it's definitely a lot of counseling the parents in addition to the kids.
Yeah.
With that, I know you like to specialize in anorexia. Why? Tell me a little bit more about, um, anorexia in general so our viewers can learn about that, maybe specific to college athletes, but why did you focus on, is that the demographic you focus on?
Yeah. I don't know. The funny part is my co-owner and I, the plus about the two of us is, as your kind of major three eating disorders, you have bulimia, anorexia, binge eating. So we both do bulimia, which will be, purging, so making yourself throw up is the main behavior within bulimia. And in particular in bulimia, for that diagnosis, you don't have the restriction of food. Because within anorexia, we have anorexia restriction, and then you have anorexia binge purge. So there's two different subtypes within it. And then your last one, kind of major three, is the binge eating. My co-owner loves working with binge eaters. And then I love working on the other side. So the nice part is between the two of us, we are able to kind of provide that entire care to the eating disorder population.
Yeah.
I think for me, it comes because I came from a body focused sport. So definitely have dabbled around with, some of those disorder behaviors in terms of, counting calories or weighing myself here and there, see if I could be less, and being engaged on the track team and knowing, of course, there are times where if you lost, there was a rumor at some point, if you lost 5 pounds, you lost, I think, 5 seconds off your PR in your 5K.
Wow.
So being around those behaviors,
Yeah.
a lot. I've seen it and I hear it and I know them a little bit more, which I think is why I tend to do a little bit better with that population. My co-owner, her degree is from Maryland Integrative Health Institute. So because of that, that gives her the perspective of working with people with larger bodies and those conditions, and how can we approach that from a food is medicine, a food is good aspect, then taking things out. So I think that's kind of why each of us fell into kind of where we did within our kind of particular niches now.
Yeah. I thought that was interesting. Lose 5 pounds and get 5 seconds off your PR. What are some of the other common, behaviors you see with anorexia specifically that, or
Yeah.
whether you've experienced it when you were an athlete or, some of your clients have experienced?
Yeah. Running in Silence is a really good book too. She was a cross country runner and talks about kind of some of those rumors, some of those things. We see excessive movement is a big one. I had practice earlier, and what's the difference of I had practice earlier, I'm gonna go run a little bit extra to get better. Or I'm gonna go run a little bit extra because I'm not performing well, or it's a punishment, or I need to continue to lose more. And that one's tricky. That one is a really fine line to play of, you're right. If you put more work in, am I gonna be better? I see that aspect, but when is it a problem behavior of, you worked out, you did your practice, and then you went and hit the gym for 2 hours? That's a little much. That one's pretty common too. What we see a lot, is of course intake within food. Most teams, they get lunch or snack or whatever after, games on the bus. Does one athlete always pack their lunch? That's kind of weird if everybody else is having team food.
Yeah.
Or, hey, everybody went out to eat after, and then Timmy didn't come with us. Or, okay, we just ate. Where is she? Where'd they go?
Right.
It was kind of that withdrawal. And of course, once you get kind of past just the initial external behaviors, you start to see those internal aspects of, okay, the whole team's hanging out and she didn't come at all.
Yeah.
Or he didn't come at all. And, oh, they're more withdrawn, they're snappier, and that's kind of, you see those behavior changes within people too, once you get past those external behaviors as well. And those are kind of some of those common ones, which is why it matters that teams and coaches know, because you would be able to tell if you were paying attention. You would start to pick up on those things slowly within a teammate. So that's kind of those important things for why team dynamic really matters, because they're your biggest advocates as a coach,
For
is
sure.
their teammates first.
Yeah. And they want to be a part of that community and fit in.
Yeah.
For sure.
Like I used to love going to Chick-fil-A after track practice. We went like every Wednesday. It was great.
Yeah.
$5 tray, 1 penny, $5, 1 cent. It was great.
So tell us about some of the other, you touched on anorexia, which is, you and your partner kind of divide and conquer on anorexia, bulimia, and binge eating. I know you guys also treat a variety of other conditions like hormonal health and chronic illness. Touch on a couple of those, or some of the main ones you see outside of the
Yeah. So a lot of those actually come from our dietitians. They tend to be a little bit more specialty in that. Helena is women's health, GI conditions, and then Kat, one of our dietitians, also comes from Maryland Health Institute University. So the two of them, they have kind of that holistically approach And you don't often find a holistic approach provider who is also health at every size.
Mm,
And that's that basis of, you can be healthy in a big body, you can be healthy in a small body. It's based off of what health looks like for your body, and that's individualized, so it's not tied to a number. And the key about that is that's kind of why they have that niche in terms of they have that more natural approach to food and health with being health at every size. So they do pull that women's health, is how can we, our old dietitian who left us to go to a higher level of care, she really loved to do women's health with fertility. And how can we use food as a good thing and use it to balance our hormones and do this without restricting or cutting foods out or cutting items out. Same thing with GI conditions and chronic conditions. Most of the chronic conditions we see are people with high cholesterol, diabetes, or pre-diabetic, and how can we control sugars better, cholesterol better without medication.
mm-hmm.
And a lot of that is we know through the basis of intuitive eating, which is, us trusting our body that it knows what to eat, when to eat, how much to eat. If you're a diabetic, you are not going to feel good if your sugar is high. It sounds trickier than it is, but it's really just that simple. You're not going to feel good if your sugars are high. But so that's how we can use that intuitive eating principle of all food's good food. All food is good food. It has a place for you. It has a time for you. And we control our sugars through that principle. Same thing with GI. At the end of the day, yep, there's probably going to be a time where you're going to have whatever trigger food you have just because it tastes really good. And that's that intuitive eating. I really want this food. I don't feel great after. Okay. How can we once again balance our GI symptoms with also honoring our cravings and what our body wants?
Mm-hmm.
So that's kind of that really other aspect that the practice takes, is seeing those conditions and those pieces. And that is a little bit more unique because traditionally, a lot of times, let's say with gastrointestinal in particular, we're kind of going to go with elimination diet. It's kind of the way that those are traditionally treated, is let's pull everything out, take away gluten, take away dairy, take away this. And that's a really restrictive diet. And that could lead to overeating, binge eating on those items later, especially if it was a favorite item, because you took that out of your diet, you took that out, you didn't get to have it, maybe you crave it, and that really heightens those and leads to that later.
Yeah. And Crohn's and diverticulitis, do you guys see that a lot?
We've seen a few, not too many. Like we've
Mm-hmm.
probably had maybe a case, 2 cases a year
Okay.
or so.
Yeah.
Not super often, but definitely come in, here and there.
Yeah.
Yeah.
And how many dietitians do you have total between the two offices?
We have, including my co-owner and I, because we're dietitians, there's 4 of us.
Okay.
And then we have 1 therapist
Okay.
and staff. Yep.
And so how has that been, going from opening just a few years ago to now having 4, total providers within the, and when did you open your second in the Silver Spring? When did you guys open Silver Spring?
May.
Wow.
So it's been a year. We've had to kind of learn just, on the business owner side away from, anything else is, what's that sweet point of having an employee? And, when do we see less people to have them see more people? But also we still, we want to be comfortable because it is a living for us at the end of the day too. So how do we balance the numbers? As I'm sure you know that, how do you balance the numbers if you're going to see less people, but Peter's going to see some more people, or the new doctor's going to see new people? And it's a tricky game to play of finding that. Really, the reason we started Maryland is we kind of found ourselves always trying to figure out, okay, well, I know there's these practices in Baltimore. I know there's these practices in College Park. There's not anybody in Silver Spring. There's not anybody blank, so kind of listening within our community, where are these holes? A big key for us, is we are an insurance-based private practice, and that makes us pretty unique. A handful of us are now. It's definitely started to become more common. But when we started, we were probably like one of maybe like 3, 4 private practices in the area that took insurance. So that made us pretty unique. And that was a lot of it, is where can we send these clients that we're getting virtually from Maryland for in-person services that take insurance? And that kind of led us to opening that office.
And why is that so hard to find? Why is it unique to be a practice that takes insurance?
I think it comes down to the basis of eating disorder care is still stigmatized sometimes. It's the basis of, do I need care? Am I sick enough? Do I need this counseling? And insurance is difficult. There are a lot of insurance plans that just don't cover dietetics. A lot of plans cover 3 sessions and then they're done. Some cover it based on medical necessity. And, we have to go and fight with insurance and prove why, anorexia is a problem, why bulimia is a problem, why binge eating is a problem. And because of that, I think that's why a lot of practices don't take it. Because it's my co-owner and I, that's why we take it. We have learned. We definitely fell on our faces a few times, having to figure out how to take insurance, how to submit, how to bill, how to code. And if it's just you, that's a lot to do.
Mm-hmm.
Let's say it's just you and maybe you want to hire a biller, that's an expensive person to pay to bill for you too. So I see why practices don't take insurance. It's a heartache. It causes delay in payments. You don't always know if you're going to get paid. And in some cases, you can't really go back and charge the client depending on what insurance said. So it comes with more liability as well.
And so, from a business perspective, how have you guys been able to, obviously you're doing very well. You've got 2 locations now in less than 2 years, and you've got multiple dietitians on your staff and therapists. So, from a business standpoint, like how do you make the numbers make sense and how do you keep the lights on? Because obviously we all want to help people, but you also have to have, you have to make a living. You got to feed that baby. So how have you guys been able to navigate that where so many other offices are just like, I'm not doing it. I'm not going to deal with insurance. I'm just going to charge cash or
Yeah. I literally saw somebody on one of the Facebook pages the other day say, good intentions don't pay the bills.
yeah.
And I think as an insurance-based practice, we sometimes bend more because, you're right. Same thing. We all want to help people. That's why we started this. But you're right. At the end of the day, sometimes good intentions don't pay the bills. So it's that dynamic, finding that balance of when is no, or when is, hey, we've tried to get insurance coverage, we can't get it. It's like I said earlier, it's the same thing with when we brought on our employees. When is the time to hire again? When is the time to not hire again, and make a little surplus money
Yeah.
instead of hiring and having a wait list and maybe taking your surplus away a little bit. Same thing with that aspect too of insurance and making the numbers crunch and fit. We're probably 75% insurance, 25% private pay, if I had to guess, if I broke down the numbers. And one of the main insurances we don't take is Blue Cross Blue Shield. It's kind of the only common one in the area we don't take. And we need to not take it because we need to have cash readily available still.
Uh-huh.
Because let's say this past week we had Thanksgiving. Holidays suck for insurance.
No one's processing any claims over Thanksgiving.
No, and that was one of the roughest lessons we learned the first year. I think we went into January and we were like, wow, we have not been paid for like 3 weeks by most of our insurances. And that sucked, and because of that, we were more careful about how much we paid out. We keep a good chunk of money in our bank account because there's the chance, insurance isn't going to pay out for a week or two. And we need to have money available because at the end of the day, you're right, bills have to be paid. And that came from the two of us being pretty frugal at the beginning and not paying, we paid ourselves enough, but we paid ourselves, not more than what we needed to because we wanted to have the safety blanket that we have now to know that it's okay.
I always give that advice to people who are interested in starting their own business or their own practice. I'm like, you all have to realize, like, you have to be psychologically and financially prepared not to get paid for the first year, maybe the first couple years. Like, you have to be okay going into credit card debt. You have to be, that's like, I feel like the definition of entrepreneur is like just believing in yourself that it's going to work. And the risk tolerance is very high, right? How do your patients, I'm interested to find out if insurance doesn't reimburse, how do your patients react when you bring that to them? You say, "Hey, listen, like I really want to help you, but unfortunately, insurance isn't paying." Are a lot of your clients willing to say, "Hey, yeah, I understand. I'll pay out of pocket regardless," or do a lot of them just say, "Okay, I'll stop care at this point"?
Yeah, it really depends why they came in. And because, like most practices, we see more than just eating disorders. We see the GI, we see the women's health, we see the hormone, the chronic conditions. And it's not to say that those who have women's health, hormone health, GI, chronic, don't care about their health. They absolutely do. Those people tend to be less willing to pay out of pocket.
Yeah. Okay.
A lot of that, I think, is because with eating disorders, maybe it's because you do build a different rapport with your provider. For a typical GI case, you're going to see them once every 3 weeks to a month. With your eating disorder patient, they come in the door, you're seeing them every single week. So you get to know that provider a lot different. So our eating disorder cases tend to say, yep, I am absolutely going to keep paying you. A good amount of the other patients do as well. Just if you had to pick somebody who typically falls off, it is going to be one of those people. And I think a lot of it is people don't go to nutrition first a lot of times for those conditions. And that, they do nowadays, and that's showing the change that our field is having of understanding why nutrition's important and why our jobs matter. And, those people who understand that are the ones who are more likely to stay. and those who are still kind of figuring out why dietitians matter, why they need us, why our field matters, why maybe the doctor told them to go see a dietitian. Their MD encouraged them. Those people, my doctor encouraged it, so they're more likely to stick around. People who kind of found us, or maybe somebody told them they should do this, it's a little bit different. And it comes back to how much they're valuing their care for nutrition. And I get it. Same thing. I know lots of people who don't go see a chiropractor. I value it. I'm willing to pay for it. Comes back to that. And I'm sure you see that too.
Absolutely. I'm glad you brought up the eating disorders being more of like a weekly, treatment plan versus, other conditions, maybe every 3 weeks. What do you see long term with eating? I'm interested in eating disorders specifically. So any of our viewers that, you know, may have an eating disorder or a loved one with it, like what do you, since anorexia is your specialty, like if you're seeing them weekly in the beginning, how, I know every patient's different, but in general, like long term, what does that look like? Obviously, it's a disorder that doesn't just get cured overnight, right? So what's kind of the typical, in the beginning you're seeing them weekly, but then long term, what's that look like for a patient coming in with an eating disorder or anorexia?
I can tell you statistically, eating disorder care from start to end is 7 years. That does
Wow.
not mean it's 7 years straight,
Wow.
but typically you will incur 7 years of treatment throughout.
Wow.
My co-owner and I love to say recovery versus recovered. And
Uh-huh.
it touches on exactly what you just said. It's not something you kind of just get better from and move on for forever. It's a
Yeah.
mental health condition. There's going to be highs, there's going to be lows, there's going to be flourishes that happen throughout the middle where, oh, I struggle for a little bit, and then I'm okay. So it is a long adventure. Generally, I'd say you probably see people, statistically, once again, if we break it down, if you go to the highest level of care, you start off at residential where you live there for care, you're generally there for 30 to 45 days. You step down to partial hospitalization, which is that next level of care. Statistically, you're there for about 8 to 12 weeks. You step down again to intensive outpatient. That one can be anywhere from, like 8 weeks to 16, 20 weeks. Outpatient, I would say, shortest stay, maybe 3 months if you came from working down all the levels of care. Some people, to do the steps correctly, you do every single step, you go every single program. And sometimes because of that, you get cases that, they're so done with care, they're so ready to get on with their life. They are like, okay, great, how can I get out of the outpatient as quick as possible? And they might be a 3-month person.
Yeah.
But then, of course, you have people who you see for a year, 2 years. I think the longest right now, we opened in 2021. We definitely have maybe 5 people that we've been seeing since we opened still. Yeah, which would now put them at, about 2-3 years of
Yeah.
care. Not always a weekly. We've had clients that see us weekly, so they step back to every other week, they step back to once a month, they step back to check-ins. That's kind of the traditional. What we like to see is weekly, every other week, once a month, as needed. Probably I'd say maybe a year if I had to put a number to it,
Yeah.
based off of just what we've seen.
Cool.
Yeah.
And so, what's been the most rewarding part, starting your business and now having 2 locations? You've got a couple years under your belt. Is it the improvements you see in the clients? Is it the team you've built? What are kind of some of the things that are most rewarding to you?
I think both of what you said. It takes a special person to go into eating disorders. My undergrad program every year asks some of us to come back and speak. And people go, and a lot of people ask about eating disorders. It tends to be something that people are pretty interested in. And, like, how can I get into it? What are tips and tricks? And a lot of questions people ask is, how do you not burn out? Because it can be a pretty depressing field.
Yeah.
It can be hard. And I get it. A lot of it is, how do you not take your work home from you? If you do have a client who's really sick and, they're starving themselves, or they're purging every single day, or they hate their body, and that can be a lot to take in. So I tell people a lot of times, you have to want to do eating disorders in particular. If you don't want to and you kind of feel like you want to fall into it, it's a little bit harder.
Mm-hmm.
You could happen to find that, oh, this is exactly what I want to do. But it helps to want to do it and need to do it and really want to do it. I think that drives people to this field and what
Yeah.
makes you a good clinician.
Yeah.
I think on the flip side of being a business owner, funny enough, wouldn't have told you I wanted to do that originally.
Mm-hmm.
I kind of thought I'd go into clinical dietetics and go in the hospital, and I
Yeah.
did that for a year. It was great. It got boring, for being honest. It's always so different, and never thought I would end up at private practice or owning my own private practice. But honestly, my co-owner is the one who dragged me along, and that's why we're here. But for us, every time we've interviewed for a new dietitian, one of the things that we tell them is, we want them to have their own autonomy. And that's really important to us for them, is because we don't want them to burn out. And we really want someone who's going to mesh with our team. So we are selective to who we hire. And the people that we've had that ended up leaving, They weren't part of the team. And I think that shows, it helps show us and helps, show the team too that this is what we're looking for. And we want that team aspect. And we really want someone who's going to mesh with us, and you're going to mesh with each other, and you're going to support each other. You're going to chat each other for support and help, even if we're not in the office every single day. And that's probably one of the biggest things for us is right now. And even right before this, we had a great team and everybody loves each other. Everybody supports each other. It's not a competition, which I think helps because, you're right. It's like the phone rings. Who gets those clients? And is it a competition? And we have that transparent conversation of this is how we're assigning clients. This is how we're giving them to you. This is how we're pairing them out. So then it isn't a back and forth of, well, she got 2 clients and I got none.
Yeah.
Mm-hmm.
Totally get it.
Yeah.
What types of boundaries do you set, Allison, so that you don't get burned out? Because I feel the same way. I guess any physician, right, in the health field, you're dealing with people, it's like physical, it is emotional sometimes too, but it can wear you down, like you said. It's, people, my pain still isn't getting better, or, oh, I can't do this yet. In your field, it's obviously physical and emotional or, mental, right? So are there certain tips or tricks that you do to kind of be able to just leave your work at the office and then go home and be able to, have family time, or is that a difficult balance to?
Yeah. I would say at my first job, it was an incredibly difficult balance for me. And some of it is I started my first job at higher level of care, which is already taxing. They're sicker, they need more care, they need, you're getting emails, you're getting calls, you're getting, the boundaries aren't there.
Yeah.
It's because they're so sick. And it was during COVID. So, zero boundaries out the window. I think one of the most important things as a provider now, and I would tell our employees, is self-care.
Mm-hmm.
If you don't have any way that you know that you can go take an hour for yourself or go do blank for yourself or go do this, then yeah, you're going to go home from work. You're going to take home maybe what was really rough sessions. You have no debrief. You go right back home, right into your night. You're tired. You're exhausted by the end of the day. Even if it's reading a book, even if it's doing blank, what's one self-care thing that you can do for yourself every single day? I think some of it just comes back to learning to, compartmentalize.
Yeah. Yeah.
Too is, this isn't a box, and it's hard. And what we say a lot to our providers, especially new providers, and we've all learned this lesson, is you cannot work harder than that client.
Mm.
And I think that helps not take your work home. You cannot do it for them. You can want to do it for them. You can will it for them as hard as you can, but you cannot do it for them. And you cannot work harder than them. And I think that helps as you mature as a provider, be able to stay in the field and not burn out.
I'm so glad you brought that up. I totally forgot it. That's exactly what they told me in school. They're like, we have to educate our patients, and this is for all people out there. We are here to help you, but we cannot do it for you. You have to take an active role in your own treatment or recovery. That is so good. That's a gold nugget. I got to write that down because I have to remind myself that sometimes, right?
Yeah, and I do too. I've had clients that I've seen for so long. We see so many new providers doing way above beyond their job, which is great. We love the initiative, but you're going to burn yourself out because if you're doing all this work, what are they doing? Are they doing all that work too? Because if not, there's a disconnect here.
Sure. Absolutely. Well, now that I'm so glad you said your co-owner dragged you along into private practice. That's great. Now that you're in private practice, if somebody was looking to get into, well, first, my question is, if somebody's in school or if somebody's listening that's interested in eating disorders, what advice would you give them if they're looking to become, a dietitian? What would be some words of wisdom?
Yeah. I think becoming a dietitian in general is just, what are your principles going to be? And the reason why I say that is, we soundly believe in Enlighten, we're all health at every size, intuitive eating principle, dietitians. And that's our foundation of all foods fit, all bodies matter. We don't have any of that. We don't promote any weight loss. If you're a dietitian who supports weight loss, and that's okay, that's going to be your principle. So that has to be step one, is what type of provider do you want to be? And then kind of start thinking about, what aspect do you want to be in? Dietetics is a very big world, and that's the crazy part is, a lot of times in school, we're kind of taught clinical is the way to go, but there's way more out there than clinical. And to be honest, maybe that's why I thought I'd go clinical, because I feel like that was pushed more than any other aspect. But, there's sports, there's business, there's teaching, there's senior living, there's kidney, there's renal, there's all these aspects of dietetics. Figure out where you go. Then if you want to get into eating disorders too, great. We are always hiring. Places are always hiring for care. Start shadowing. I think shadowing and trying to get one of your rotations, because our dietetic internship is required. trying to get some experience of shadowing is really important. It gives you a good idea of, is this actually what I want to do? And I think that goes for any career in medical.
Yeah.
Shadow.
Yeah.
Try to get into shadow. I thought I wanted to be a physical therapist. I shadowed in high school and realized I really don't like feet enough to be a physical therapist.
Yes.
And that was it for me. Totally
Yeah.
pivoted after that.
Yeah.
And it only took, that high school internship that I did at fourth block, for an hour, 3 months to realize, okay, that was actually not what I wanted to do with my life. And that's really valuable for people.
Yeah.
Yeah.
Get out there and get shadowing. We've got somebody coming by to shadow later this week, so I'm glad you brought that up. What
Well, we
about
just had some interns.
now
So we're
transitioning to more the business side, Allison? Like what advice would you have somebody, say they are working in a hospital or say they are working in, a senior living or some sort of other, what advice would you have somebody who wants to go into private practice or open their own business? What advice would you
I
have for
think
them?
that the biggest part is exactly what you said. You have to weigh the risk and reward. I think you have to want to do it. And that's one of the biggest things. If you're kind of dabbling with the idea, I think it's helpful if you're like, no, I definitely want to do this. Because you're right. We did not make a whole lot of money the first year.
Right.
We make decent money now, but we're still not raking it in.
Yeah.
We're still billionaires, we're not millionaires, we're still working every single day, we're still doing all the things. So that's why I think it matters in terms of, well, why do you want to do it? Take the jump. If you think you want to do it, you absolutely can. Do it. Ask others, ask other business owners, ask other friends, ask other people, and get their advice too. And talk to your spouse, talk to Blake, talk to whoever, is your own support system. Because I think ultimately, as you know too, with Jasmine's support, same thing, if I did not have my husband's support with all of this, I would not be doing a whole lot. And that matters too.
I think that's one of the biggest reasons why so many small businesses fail. If your partner, I can't echo that anymore. If your partner is not on board with what you're doing, it will fail, or you will not be successful.
Yeah,
I think
absolutely.
the only reason a lot of times we are so successful is because Jasmine, what was that conversation like with your spouse when you decided to go into private practice with your co-owner?
Different, because it was the basis of, the plus is there's two of us. So it did take us longer to build if it had just been one of us.
Right.
We call ourselves, generally our providers call ourselves full in terms of clientele at about 20, 25 sessions a week.
Mm-hmm.
We don't work 40-hour sessions because the burnout, if you saw 40 clients a week for an hour, every single one.
Yeah.
Way too much. So most people see 20, 25. So there's two of us. So it took us 40, 50 clients to get full. We both worked full-time jobs while we did that before we transitioned all the way out, which I think helped, in terms of my husband and I still had my clinical salary in addition to that. Then we had my part-time clinical salary in addition to the practice. And you're right, we took that final jump. And a lot of it is he's very supportive in terms of, asking me what I should do or how I should do this, or Blake, and he'll say, it's really what you want to do. And that's a privilege that I have because, he does have really good job stability. He loves his job and he makes enough for us to take that risk on me. And not everybody does. And that's a conversation for you to have with your significant other. If that's not your boat, is how can you make that work then? And take that risk for you to follow your passions.
Sure.
Yeah.
What was that first year or first? I'm glad you brought up. I didn't realize you were still doing when you started your private practice that you're still doing your clinical practice. What differences did you notice when you jumped in 100% into your private practice versus when you're doing kind of both at the same time?
I feel like I don't know if others would say this. I feel like I worked way harder when I left clinical. And I think maybe it's because I didn't have the blanket anymore.
Uh-huh. The
Um,
security.
yeah. And we worked our butt off even when we were building the practice because we wanted to get to the place where we could quit. But then I felt like then it was like, okay, what are we gonna do to make sure we continue to stay successful?
Yeah.
What can we do? How can we do this? The reality is we stepped away because we didn't have the time to continue to work, and give our practice and all, and that's why we did that. So I think it's not overcompensation at the beginning of just, okay, this was risky, this is terrifying, what are we gonna do now? That was probably it at the beginning. Now, of course, we have a flow and it's way smoother.
Yeah.
But at the beginning, that was tough. That was tricky. We didn't take insurance until 7 months into opening.
Mm-hmm.
So that was one of those things too, that calculated risk of when can we take insurance. So we started taking insurance in like July, and then we left our full-time jobs in January that following year. Yeah.
And growth-wise, what did you notice in the year previous and then after January when you left your other What did you see growth wise? And like, was the growth kind of steady before you left your other job, or did you see any increase after you left your other job in your private practice?
I would say yeah. I mean, we left because we knew we needed the need to see more clients. Because the reality is when you work the other job, you're there for 8 hours, so you
Yeah,
can only see so many clients when you
yeah,
come home.
yeah.
Even if you only work 32 hours, and you have a whole 8 hour day, you can still only shove so many people in. So it made it that we didn't have to take a wait list and we continue to see it, because we could have kept our clinical jobs or other job and taken a wait list and just said, we're okay seeing 10 each.
Yeah,
We'll put the other people on a wait list and when people discharge, we'll bring them in.
got it.
So allowed us, you're right, that continued to grow. And then from there it became after January, we hired our first employee that May. Same thing of, well, we could help 60 people instead of 40 people. So on and so forth.
Awesome. All right. Well, what's kind of going on in the future for Enlighten Nutrition? What do you guys anything new upcoming or any exciting news in the near future?
Not as much right now. We just went through some transitions. We had some employee turnover, and that's okay. We had our other two dietitians with us for close to a year.
Mm-hmm.
And it was their first job out of college, and they need to figure out what they want to do, and that's okay, and we support them. So we have two dietitians now that we adore. We adored our old ones too. We've loved all of our employees. So on the part for us is just, we got through that transition. What are we going to do to finish the year strong, kick off next year into January strong again with our staff, continue to build our team dynamic, probably some more growth. Don't know if it'll be another location or maybe just continue to grow within Leesburg and Silver Spring. We rent hourly at our Silver Spring locations. What would it be like to have a space of our own? That would probably be the next step there of, can we get that need from clientele to really set down the roots a little bit more in Maryland, maybe West Virginia. We've always explored those options too. West Virginia is hard because it's really high Medicaid, Medicare area, and we can't take those insurances, and they can't technically pay out of pocket either, because they shouldn't be able to afford it if they're on Medicaid, Medicare.
Right.
So we don't know, but we know growth is definitely what we want to do. So just figuring out which way we want to grow in is kind of our next steps.
Okay.
Yeah.
And how many dietitians in Maryland do you have currently?
One. So our Maryland dietitian actually does Maryland and Virginia. So she does 2 days here with us. It'll be one day probably in the new year with us in Virginia and her other days in Maryland.
Okay.
Yeah.
And how do people find you, Allison, if someone's looking for a dietitian or someone's looking for help with an eating disorder or a GI or chronic illness? What's the best way to get in touch with you?
Word of mouth tends to be most of our referrals. Eating disorder referrals definitely tend to be word of mouth from another provider, a pediatrician, a website, facility. GI, chronic, women's health, those sometimes tend to come off insurance websites in terms of searching for providers. In terms of finding us, our website, Enlighten Counseling Care. My co-owner designed it. She loves it. That's her baby. You can always reach us out there. Phone number, email, give us a call, give us an email. Best way to get in contact with us. We're pretty quick too. Because
Awesome.
of course, our boundaries are only so solid sometimes.
I get it. I get it. We
Yeah.
always talk about setting boundaries, and then it's a Friday afternoon, and there's that last phone call of a patient who wants to get squeezed in, and you're like, yeah, come on by. I'll stay late.
Yeah. Yeah.
So
We're really bad about it. That email at 4:40 p.m. Should I call them back? Should I email them? Yeah, I'm absolutely going to do it because it's not 5 yet.
that's it. That's it. All right. Great. Well, thanks so much for being on, Allison. If anyone is interested in getting in touch with her, you said enlightennutrition.com or what's the web?
Enlighten Counseling Care is the email.
Enlighten Counseling Care.
.com.
.com. Awesome.
Yep.
All right, Allison. Well, thanks so much for being on. We really appreciate it.
Yeah, thanks for having me, and thanks for dealing with this one.
Just look at her now. She's all snuggled up with mom, not
No,
making a
she's not.
noise. So happy. Awesome.